It only takes 30 minutes, maybe 5 or 6 times to really get this interview stuff down. You don't have to practice for hours and hours and hours. You literally don't. I just had a mock interview and there's a common thing with people preparing for interviews. There's a very common thing, and it's people getting overwhelmed by just all the freaking information that's out there. And I just wanted to try to kind of help you guys not be as stressed out about all the information that you're getting from other people. There's books, there's so many videos, there's all these like tips and tricks. And I just like to give people actionable, simple stuff to do that'll take like 30 minutes a day. And you're going to be leaps and bounds above your competition for interviews. So first things first, I just did a mock interview. I just got done with it like a few seconds ago. And she kind of like gave me this feedback that is so freaking common. It's like she's reading that book. I'm not going to say who it's by, but it's like the one book that everybody reads for PA school interviews. And it's got so much stuff. She showed it to me. She had like Post-its and highlighting, and she was treating it like a freaking textbook. It was like she was studying for OChem. And I was like, how is your mental state studying all this? And she goes, honestly, I'm in my head way too much. And like when we did the mock interview, she literally like froze. She would restate the question. She would seem confident for 2 seconds, and then she would freeze. She would just stop. And I was looking at her like, you got an answer in there? What's going on? And then she would be like, I'm sorry, what was the question? So she would literally restate the question, freeze, and then ask me again what the question was. So it's like, what the heck? Like, some people are so overwhelmed by the process, and it does not need to be overwhelming. I promise you it doesn't need to be overwhelming. So let's answer a couple questions, and then we're going to get into this, and then we'll probably hop off. Okay. Do you know the style of MCPH interview, and if it has a writing prompt? Off the top of my head, no, definitely not. If you got an email saying, you have an interview, usually they tell you what to expect. If not, certainly Google it, get on the forums. But if they don't tell you anything and you can't find anything, I would be ready for everything. Can you make $200,000 within a few years out of PA school? Yeah, absolutely. Depending on what specialty you work in and how ready you are to work more than 40 hours. If you work freaking urgent care, you can make $200K within the first 2 years of your, of being a PA. But you're going to be picking up some overtime. You're going to be picking up shifts other people don't want to do, maybe in clinics that nobody wants to go to, right? Like rural clinics, unhealthier patients, more frustrating patients, that kind of a thing. You might, if you have like a company that has a good bonus structure, that kind of thing. Yeah, you can definitely make $200K as a PA. Obviously, derm, everybody knows about derm. Certain surgical specialties, hospital-based stuff tends to pay more than clinics. So if you do a lot of procedures, outpatient, or if you work a lot of shifts, a lot of overtime shifts, night shifts, that kind of thing, yeah, 200 is definitely achievable. Is it something I want to do now myself? No, money's less important than freedom to me now, but yeah, you totally can. What are the chances of getting off the wait list? Can't really answer that. I don't know. Have I heard of people getting off the wait list? Yeah. Do you think schools find college athlete applicants more valuable? I don't know about more valuable, but it certainly is impressive, because if you explain how rigorous being a college athlete is, and then you talk about how you still manage to get good grades, yeah, that's super important. Is it going to be as important as GPA and hours? No. How many shadowing hours do you recommend? Do you think getting an LOR from them is a good idea? Yes and yes. So depending on if your school requires shadowing hours, some schools I've seen require as many as 50 or 200. So make sure you see if your school requires shadowing hours. I've seen some crazy stuff. They require shadowing hours from 3 different providers in different specialties, sometimes 10, 20, however many hours each. So read the instructions, read the requirements before you really ask that question. But if they don't have a requirement, I'd say a good rule of thumb is about 50. Try to get a couple different providers at least. And a recommendation letter from at least one of them is a good idea, preferably a PA, because if you're trying to go to PA school, you got to have a PA vouch for you. It's just kind of how it is. So definitely get a letter of recommendation from a PA, whether it's someone you work with, you have somebody you shadowed or anything like that, volunteered with. So we will maybe do a few more questions later, but let me get to this interview stuff, okay? Interview stuff is super important. If any of y'all in the comments have interviews, first off, hit the like button. Second, put them in the comments, where you have an interview, what format it's going to be. All that is super important. Would you rather have butter or cream cheese? Cream cheese. Come on, whoever puts butter on their bagels is freaking crazy. Cream cheese all the way. Bagels are the whole reason to even like have a bagel is so that you can eat like a whole tube of cream cheese. I could eat that stuff without a bagel, like with a spoon. Maybe I'm crazy. But anyway, okay. So if you're preparing for an interview, let me flip my camera just so you can see this. If you are preparing for an interview, don't overthink it. Don't get overwhelmed. Don't get in your head. Literally just do these steps and you are golden, okay? MMI 4-step method has been helpful. That's what we're going to talk about in 2 seconds, all right? There we go. Traditional interview, University of Michigan, next Tuesday. Sarah, I got you. Sarah, check this out. So traditional interview means they're going to be asking about your application, means they're going to be asking like basic interview questions, not necessarily scenarios or anything like that. It's going to be questions about your application. So any poor grades, any low grades, be ready to talk about them. How do you talk about them? It's one of my 6 basic questions, right? Tell me about a time when you struggled academically. So any poor grade, B minus, C, D, F, this. Be ready to talk about it. What are you going to talk about when you talk about the poor grade? Are you just going to say, oh, I was overwhelmed? Or, oh, I wasn't ready for college, I was young, or, oh, I got in a car crash and broke my wrist. You can certainly say all of that. That's kind of the reason, but there's much more you need to say. You're going to say, this is what happened. This is why the grade was difficult or the class was difficult for me. Here is what I did to improve, okay? So let's say I got a C minus in organic chemistry freshman year or sophomore year. So you're going to say, okay, yes, I got a C minus in organic chemistry sophomore year. I did not know how to study for organic chemistry. It was much more visual than other classes I've taken before. Rote memorization didn't work. Whiteboard didn't work. I was unprepared. So it was totally on me. I should have done better. Here is what I did. So check it out. Senior year, I took organic chemistry 2 and I got A minus. And here's how I did it. I got those little plastic bits where you like make the structures of organic chemistry. I started writing out the mechanisms on a whiteboard and then making smaller versions of that in a notebook. And that's how I ended up getting the A minus in organic chemistry 2. And also in PA school, if I find it difficult to with a class that I'm not prepared for, what I'm going to do is early on realize that my study methods are not working. As soon as I get a quiz grade that's below a B, I'm immediately going to start asking for help. I'm going to go to office hours. I'm going to ask my mentor. I'm going to ask my tutor. I'm going to ask my classmates who might have done better exactly how they studied and replicate their methods. And if one doesn't work, I'm going to replicate the others. And then I'm going to go on YouTube and figure out how to study for that particular class. So those 3 elements, instead of just, oh, I got a C minus because life was hard. That's fine. That's step 1. But then step 2 is later in my career, I did better by doing X, Y, and Z. And then step 3 is I am, if I struggle in PA school, which is inevitable, my plan is this, this, and this. What you're basically saying is, no, I will not fail a class in PA school and force you to kick me out of the program, because that's what happens when you get a C or worse in PA school. Or some programs a B or worse. Somebody said, I have a traditional interview. Avery said, traditional interview, Union College, September 16th. That's in like 2 weeks. You got this. So if I were you, Avery, it only takes 30 minutes, maybe 5 or 6 times to really get this interview stuff down. You don't have to practice for hours and hours and hours. You literally don't. All you have to do is get these 6 questions, sit down for like a little while, and just meditate on these 6 questions. Get a really solid answer for, tell me about yourself. What is tell me about yourself? It's who are you? Who is Avery, right? What is important to her? Does she really want to be a surgical PA because she really wants to work in surgery and really handle pre-op and post-op, and she's super passionate about surgery, and she one day wants to maybe lead the surgical department. She wants to be like the head PA, making the schedules, really leading people, teaching them, and taking care of patients. Is that your dream? Does Avery maybe want to have a family? Does she want to have 10 dogs? Does she want to live on a dairy farm and like be a PA and also use that to fuel her passion for, farming? I don't know. Like, what is important to you? Tell me about yourself, something memorable, something interesting. Why PA? This one, if you have an interview, you've already answered this. So this should be super easy, right? It's basically a condensed version of your personal statement. Not your entire personal statement, because then you'd be talking for like 10 minutes. But pick the 1 or 2 most important parts of your personal statement and just practice saying this in 2 to 4 minutes. All of these should be 2 to 4 minutes, okay? So this, YPA, just a condensed version of your personal statement that's already gotten you the interview, the end. Nice and simple. So the person I just did a mock interview with like a few minutes ago, she did a great job with this. And actually, I didn't even ask her YPA. I asked her a similar question, and she used her YPA answer to have a really good response. She talked about how her dad, they're from a different country, and that like really motivated her to help people who, didn't have access to care or didn't speak the language and that kind of thing. And it was good. So that's YPA. Struggled academically, we literally just talked about. This one is super important. Tell me about a time when you dealt with an interpersonal conflict. Interpersonal conflict can be with a patient, like a very frustrating patient. It could be with a colleague, sometimes when you were judged or criticized, or when you dealt with like a doctor that was just really unpleasant. Anything. Any sort of interpersonal tension, you want to have an example of this, okay? And that example is not going to be you kind of bitching about it, like, oh, this professor was so mean, or this one colleague was so mean to me. It's not going to be that. Or the patient was so unpleasant, I cried. It's not going to be that either. What this question is going to be is only two things, two elements, only two things. Those two things are overwhelming, very, very intense empathy for the other person, seeing things from their side. Not saying the patient was so mean to me, I cried, but saying, the patient was very frustrated and, he kept talking about how bad doctors are and how much he hates medical providers and how anyone who wears scrubs is literally the devil. And it really made me sad. I mean, honestly, I even almost teared up a little bit. I was keeping it professional, but I was very, very sad when he said these things to me because I'm a healthcare provider. I respect the healthcare providers in my office so much that like hearing him say these things was super hurtful. But of course I understood. He's been like chewed up and spit out by the system. He's had all these comorbidities, his surgeries, none of them helped his pain. His medications aren't helping his pain. He's in pain every day. Of course I understand that he'll be frustrated. If I was in his shoes, his position, I'd be frustrated. So I totally get where he was coming from. It didn't make what he said less hurtful, but I totally understood what he was doing. And then that's empathy, right? You demonstrated empathy. Then responsibility. And so what I did was I heard him out. I let him, say his piece, because sometimes people who are frustrated, they just have to say what they're thinking. They just have to tell someone and then they feel better. So I did that. I stayed professional, even though what he said was hurtful. And then I just kind of kept redirecting him to why I was there, to get his medication list, to get his blood pressure so the provider could see him. And, that's what I did. And in the future, if I have a patient that's frustrated that way, hopefully as a PA, I'll be more empowered to help them and really hear their frustrations and be able to help them, right? That's a good response to interpersonal conflict. And I'm sure everybody working in medicine has had one of these. So just bring up an example of that. And this is kind of a question that you would use that answer to anything where they were like, tell me about a patient that was frustrating. Tell me about a patient that's difficult to work with. Who are some of your least favorite patients to work with? These are all trick questions. You're not supposed to answer those questions. You're not supposed to actually say, oh, I absolutely hate working with X, Y, and Z. You don't say that. You talk about this. You give your answer to interpersonal conflict. Okay? Next, why this program? Why are you choosing this program? Why do you guys think they're going to ask you this? Is it because they want you to prove yourself and say like, you guys should choose me because this, and this? Yeah, that too. But mainly what you want to do is prove that particular program, you're interested in it. You stalk their Instagram and you're like, oh, the cohort looks really close. I see them working together. I see them like having fun with cadaver labs. I see them, having fun learning how to do injections. Also, I was curious, did you guys do real injections or was that just saline? Like whatever. I saw on your website that you guys said this, and this about this sort of method. Like, how does it work or whatever? Like, just prove that you actually researched the program specifically and that you were very interested in that program. This is your top choice. You want to go to this program. You're so interested in it, that kind of a thing. Because they're not just looking for qualified people. They're looking for qualified people who will choose their program if offered acceptance. And then any questions for us, honestly, is kind of the same thing as this in a way. It's like you do want to ask some questions. You want to be genuinely curious, but mainly it's just prove that you really care about this program. Like, what are you legitimately curious? It's a question that you can't ask any other program. So something specific. Okay? All right. So that's the 6 basic questions. Guys, post in the chat how you feel about these 6 questions. Can you think of an interview question that does not fit into one of these 6 questions? Honestly, I don't think so, unless it's a scenario, which we'll get to in a few minutes. Any suggestions after being waitlisted at my top school? Yes. Olivia, if you're still here, Olivia Hall. Okay, suggestions after being waitlisted at my top school. So if it genuinely is your top school, and you can say this honestly, I would send them an email letter of intent, LOI, letter of intent, basically saying, thank you for interviewing me, and I really appreciate, the opportunity to be on the wait list to potentially be accepted. Just writing to express my interest and let the admissions committee know that if I am offered an acceptance, I would enthusiastically and immediately accept. So you can't obviously say that for every school that waitlists you, because if 3 of them accept you, that's going to be very awkward. And it's a small community. You don't want to do that. But if there's one school and it's really your top choice and they waitlisted you, I would send them that letter of intent saying, hey, thank you very much for your consideration. Grateful to be on the wait list. Just wanted you to know if I ever get off the wait list, I will immediately accept enthusiastically. That kind of a thing. So cool. Yeah, I would do that. Olivia Hall sent a finger heart. I'm not sure what that is, but that's funny. Oh, you sent a gift. Thank you, Olivia. What else we got here? Thank you. It's all very helpful. You're very welcome. So yeah, I would totally do that if I were you, if it was genuinely my top program. Do you think they will mention the integration of AI into medicine, or what do you mean exactly, Emily? Avery said, how many questions would you recommend to ask the interviewers, or how many would be too many? So, I mean, you're not like bombarding them with all the questions at once, right? You're going to ask them whatever you're most interested in, and likely you'll get a response from them. So I would probably just have like 2 or 3 in my back pocket. So I'd have like 2 or 3 solid questions about the program that proves you actually did your research and you're interested in the program. So I would just have 2 or 3. You're probably, for the interviewers, you're probably going to get to ask like 1, maybe 2 max. But there's always a question and answer session with current students. And you do want to ask a question during the question and answer session, because a lot of times the current students are asked like, hey, did anybody stand out? Was anybody really pleasant, insightful, confident, whatever. So you do want to have like a chance to speak at any opportunity, including the question and answer session. So yeah, 2 or 3 good questions in your back pocket, ready to go. Let's see. So Emily said, like with the pushback of self-diagnosing and doubting the healthcare team. That's interesting. So are you talking about like an ethical question, or about like a scenario question? Like, will they mention AI and people self-diagnosing, or what do you mean? Like if that's used as an ethical question or a scenario question, then literally I would just use the 4-step method that I'll mention shortly and not really worry about it too much. But I mean, if you have any genuine like opinions, particularly an example would be really good. Okay, ethical with ChatGPT. Yeah. So if they're basically asking you, your patient is using ChatGPT to answer questions about their healthcare, like what would you do? Let's actually use that as an example. Okay. So here we go. I was going to do this a little later in the presentation, but let's do this right now. So this is my 4-step method for MMI, scenario, and ethical questions. So instead of like memorizing your response to every ethical question, what I would do is only practice this 4-step method with just a bunch of scenario questions. And then when you're asked something that sounds like an ethical or a scenario question, literally you just go through the motions and you've got it. What are the motions? So clarify or identify the problem or repeat the problem. So in this case, they're basically going to say, who was that? Emily. They're going to say, Emily, what would you do if one of your patients has been using ChatGPT to, get their own healthcare questions sorted or whatever, right? So let's just do this. So basically it's going to say, Emily, your scenario is your patient has been using ChatGPT to answer their own medical questions. What do you do? Okay, so what I would do is I'd go through this 4-step method. Step 1 is going to be clarify or identify the problem. So I would say, very good question. So it sounds like my patient has been using ChatGPT to solve their own medical problems, and now they're seeing me as a provider. Then step 2. Step 2 is get more information or make assumptions. So if the proctor is allowing you to ask them questions, you can ask them questions. If not, then you can just make assumptions, such as information that you'd want to know. So step 1, okay, so my patient is using ChatGPT to make their own medical decisions. So I would firstly want to know why they felt the need to use ChatGPT. Was what my instructions, was things that I told them in the past or other providers told them in the past not clear? Did they not explain things enough to their satisfaction? Did the providers not listen to them? Did the providers not hear them? Did the patient feel like their concerns were not really being addressed? If so, I would ask the patient, like, why did you have to go to ChatGPT? Did you feel like there's anything your providers wanted you to know? And listen to them. That's one thing. Another thing could be, was there a family member or a friend that had done well with ChatGPT and they influenced them? Were they just curious? Are they just really curious about their conditions? Or are they just curious about learning more? Is there any answers I could provide? I personally don't have any problem with ChatGPT. I'd love for them to be interested in their care and learn more about their care, but I want to know what I could do to partner with them. So that's getting more information, right? So then step 3 is come up with 2 or 3 possible solutions. So 2 or 3 possible solutions based on the information that I just got from them is, if the patient feels like they have not been heard, if the patient feels like providers have not really taken the time to understand what they're actually asking, then I would say, here's some time. I'm here. I'm listening. What could I do for you? What concerns do you feel were not addressed that you felt you had to go to ChatGPT? So that's one. Another possible solution is, what did you find out? What did ChatGPT tell you might be something that needs to be ordered or something that needs to be done? I'm here. I'm listening. I'm really curious. So that's another thing. And that's just, 2 scenarios. Another scenario is I would tell them that ChatGPT is not a licensed medical provider and that it's not necessarily safe to follow their advice because they're not really seeing things the way that we are. So just to use any advice they give you with a grain of salt and to run it by me, your provider, before anything else. So 3 different solutions. And then step 4 is pick one that's best. Honestly, I would probably just do all of them in this scenario. So was that pretty thorough? Just going through the motions if somebody does use ChatGPT as a patient. So it's like an ethical / scenario type question. So you could just use my 4-step method for scenario questions. Okay, what other questions is there? Is this applicable for a panel interview with an application-based question? The 4-step method, not so much. Panel interviews are basically the same as individual interviews. So that 4-step method works for ethical and for scenario type questions. Works really well in groups too, if it's like a scenario or an ethical question. So that's what that's for. The panel interview is just an individual interview, just with more people there. So then you're going to do those 6 basic questions and just study your application very well, and you're going to kill it in the panel interview. Christian says, I just started PA school. Yeah, let's go. And I'm stressing about anatomy. Any tips for remembering everything? Oh, yeah. Yeah, I got you. I don't know how your anatomy class is organized, but mine was organized in 2 stages. One, we had the lab, which was like a separate course, a separate grade, separate testing. So there was the lab where we had like cadavers, and we would have cadaver lab twice a week for like 3 or 4 hours. And then we could practice afterwards. And then after that, we would have a cadaver-based exam. So there would be like 4 or 5 stations with different bodies, different donor bodies. And they would say like, find the, brachioradialis, find this nerve, find this muscle, find this attachment, find this bone, whatever. And then we would just like have to write them down on the little sheet and then, turn it in. And if we were right, we were right. If not, then we failed. So there was that portion. And then there was the classroom portion, which was just like straight up anatomy and physiology and like different parts of the body, different like hormones, mechanisms, whatever. So for the anatomy portion, for the actual like cadaver labeling things portion, what you do is first, before even like studying the anatomy or going to see the bodies or anything, first I would literally get a list of all of the terms, all the body parts, all the muscles, all the nerves, all whatever is going to be on this next exam. I would get a list of all of it. I would just make the list, okay? And I would just rewrite that list a handful of times, 5, 6, 10, 20 times, just so that you start forming that mind-muscle connection between these like totally alien freaking terms, because they're not normal English terms, right? They're weird, long, multi-syllabic terms that like you just would never really like think out of your head unless you have to. So like I would just get very comfortable with the terminology, and that's how you do it. Then I would start using the blank out diagram. So like a diagram from your book, or you can make one yourself. You can even draw the body parts and then like label them with all the different names and then start blanking some of them out. Put a Post-it note, erase it, that kind of thing. And then start just filling them in. First make a blank out diagram with like 1 thing missing, then with 2 things missing. And then eventually with some more practice, you should be able to fill it out with literally nothing labeled. You should be able to label everything, all right? Then once you've done that, you study the actual cadavers. So you go to the cadaver lab, in class, after class, at night, in the morning, whatever, and you start finding those things, hopefully with the help of your professor at first. You start finding everything and labeling them and making sure you're right in all the bodies, because that's the one thing. If you have like 5 different cadavers, you're going to be finding them in multiple different bodies and nerves, muscles, things, all the organs. Everything looks different depending on what body it is. It's totally different. So you're going to want to find everything in every single body. Okay, so just to recap, you want to get very comfortable with the terms, rewrite them multiple times. Then you want to make yourself some diagrams where you're labeling everything so you have like a general idea, and eventually get to the point where you can label everything without any like diagram whatsoever. And then you practice with all the bodies over and over again, and then you got it. Okay, so there's that. For the actual classroom portion, it's like any other class, right? You use Quizlet, you use Anki, use whatever resources you have. For anatomy, for some reason, I thought the whiteboard was the most important, because they're usually just like small things to memorize. There's nothing too complicated. It's just like this goes here, this goes there. So I personally thought it was really helpful to just use a whiteboard, rewrite everything multiple times, condense it. An important thing, at least in my anatomy class, was make sure you're using all the resources. So like I wasn't doing well in anatomy and PA school at all until I realized that like most of the testable material was in this freaking Google Doc that like was shared, but she never really mentioned in class. So that was annoying. But once I found that Google Doc and started studying almost exclusively from that, I started killing it, because some things were not mentioned in class. They were not mentioned in the PowerPoints, and then they just ended up on the test. And it's like, where'd you get this, Professor Stearns? And then it was in this Google Doc. So yeah, find out what resources your professors give you and where the actual material comes from. That's the most important thing. The most important thing you learn in PA school is not necessarily the material. It's where the freaking material is that is going to be on the test. Because your job is not to learn everything. Your job is to get to the next test, and then the next test, and then the next test. And before you know it, you're practicing, you're 4 years in like me, and then like a patient comes in and like some random stuff is going on, and you're like, wait, I know that. And it's like, how do I know that? And you're not going to remember knowing it or learning it, but like I promise they're teaching you everything you need to know. So next test, next test, next test. Okay? But figure out where the material is coming from, because if you don't know where the material is coming from, you're not going to pass the test. Okay? So talk to upperclassmen, talk to the students who are doing well in your class. Where are they getting the material they're studying from? Is it the book? Is it the PowerPoints? Is it just lecture? Is there some ancillary document somewhere on the drive that like nobody talks about, but that's where all the material is? Figure that out, and then you're going to be the one setting the curve. Ask me how I know, right? So anyway, let me see. What other questions are there? Christian, was that helpful? I really hope that was helpful. I was trying to help him study anatomy in PA school. Let's see. How can I sign up for an interview? Oh my goodness, too many questions. Way too many questions. 1 second. Shoot, I'm sorry. I missed like all these questions. How can I sign up for an interview prep session with you? Personalstatementpros.com. Personalstatementpros, just like my account.com. You can get a interview prep or a mock interview with myself, Elijah, James, Jasenia, Juliana. We have a bunch of coaches. I'm obviously the OG. I made the company, but there's a bunch of different price points. We're all happy to help you. So yeah, personalstatementpros.com to get our help. Trying to fit in the character limit. It's about interviews. I interviewed for PA school and didn't hear anything back for 3 weeks. Then I just got an email saying, oh my God, you can't just leave it like that. Saying what? That I'll receive an email in 72 hours to sign confirming all my credit hours. Is this a good sign? I'm not really sure what you mean, Eli. I'm sorry. So does that mean that you were accepted, or what does that mean? Any tips for learning techniques, especially for antibiotics? I'm already a student. Megan. Okay, Megan, I got you. So antibiotics are kind of a pain in the butt, but the cool thing about antibiotics is they come in categories. They come in groups. And a lot of these categories and groups are used for treating similar things. All right. So the thing that taught me the best, I think this video might even be off of YouTube. I'm not really sure. Let me see if I can find it. But it's called the antibiotic ladder. It was this one like pre-med training program or something, but the antibiotic ladder was the biggest game changer for me to learn antibiotics. Here, let me flip my screen. If you can find this on like Google or YouTube or anything, this guy, Dr. I forget his name, but this, the antibiotic ladder, is the only reason I like knew antibiotics in PA school, and I still kind of like reference that knowledge back as I'm practicing PA. Because it's all about like gram negative on one side, gram positive on the other side. Which types of antibiotics cover gram positives, which types cover gram negatives, which ones have coverage for both in like a limited spectrum. And then for cephalosporins, it all goes by generation, right? So first, second generation are more gram positive. Third generation covers more gram negatives. Fourth generation and fifth, which you'll like basically never use. Well, no, fourth you will. Fourth generation covers more gram negatives. And then your fifth generations, I think, might be anti-pseudomonal, but they're like super advanced. And then, so he makes that for like the gram positive and gram negatives for like cephalosporins and multiple other antibiotics. Then he has like a baseball diamond type thing, I think, for the fluoxetins. And like, it's like he does such a good job visually explaining these things that it's like golden. It's the only way I learned antibiotics. Try to organize them visually, right? Try to organize them visually in terms of what they cover. That is the main thing. Because your test is going to say, this is the organism or this is the disease. What antibiotic would you use, right? And of course, then like you have to know their side effects. You have to know like the black box warning. So if there's a black box warning, that is a must study. Black box warning basically means this is deadly or this has an interaction that's really bad or something. So black box warnings, absolute must study 100%. Then there's some silly, there's some like really silly side effects or like bad things that can happen, like red man syndrome with, I think it was vancomycin, like that's always on the test, like that kind of thing. But the main thing, as far as like usable knowledge, antibiotic ladder, study the crap out of that. All right, whoever just liked the video like 1,000 times, I love you. Thank you. Guys, share this video, like this video, just like support the channel. We work really hard for you guys. I hope that you guys support us. Is this pathologist assistant or physician assistant? So I'm a physician assistant. My friend Shauna is a pathologist assistant, which are totally different careers. If you guys have never heard of what pathologist assistant is, put that in the chat. But basically, it's a mid-level provider, kind of like physician assistant, but they don't treat patients. They work in the lab. So they work in like the diagnostic lab. They work with specimens, with not fluids necessarily. They usually do like accessioning, that kind of thing. So like, let's say you get like a colon biopsy or something, and you need to look at it under the microscope to see if it's cancerous. A pathologist assistant would do that. So you're in the hospital, you're in patient care, you're using anatomy at a very high level, but you're not directly working with patients. So if you're kind of more of like an anatomy nerd that doesn't really want to work with people one-on-one, pathologist assistant is a phenomenal career. They make a lot of money. They have great schedules. They work in the lab. So yeah, that's always a good idea too. I actually did a whole like hour-long video with Shauna, my friend who's a pathologist assistant. I don't think she's on social media. Like I have her email. I don't think I have her on social media, but let me show you the video we did together real quick if you want to watch it. You're pre-PathA? Oh, okay, yeah, this is the video you have to watch. This is absolutely the video for you because she doesn't just talk about like working as a pathologist assistant. She talks about like how to get in, the experiences that she would recommend, that kind of thing. So give me just 1 second. I'm going to get you Shauna. Here she is. Okay. So I'm going to flip my screen just for a second. I know this is really specific. Hang in here with me, guys. I'm just going to talk about pathologist assistant for 2 seconds. This is what the YouTube video looks like, okay? And it's called Pathologist Assistant Interview. And it's going to be on my YouTube channel, Personal Statement Pros. So this is us. It's that, handsome guy right there. It's that lovely lady right there, Shauna. And obviously that's me. Pathologist Assistant Interview is what the video is actually called. So, I wish I could link it in here, but I can't. But anyway, it's an hour-long video. She talks all about being a pathologist assistant, what school was like, her recommendations for applying, what experiences you would have, that kind of thing, what classes to take. So if you're interested in pathologist assistant, definitely go on YouTube, Personal Statement Pros, and just type in pathologist assistant interview. And it's one of the only ones. It's also on TikTok, but it's harder to find on TikTok. So just go on YouTube. So anyway, yeah, she talks about a lot of valuable stuff. And she's awesome. Shauna is like the quintessential pathologist assistant. Like very quirky, loves pathology, loves her science, total nerd. She's great. But anyway, is there chem in PA school? Not really. There's no like organic chem, biochem, but there is a lot in pharmacology. So you're not totally getting away from chem, but there's a lot less. There's not a lot of it. Let's see. Are there opportunities to serve in the military as a PA? Oh, yeah. Do they cover education? Not sure. Yes. Who is that? Abby? Yeah. So there's a few ways to get your PA school paid for completely. You can do NHSC, National Health Service Corps, which James, one of the people on this channel, he did that. So he got his tuition, his living expenses, everything paid for, graduated PA school with zero debt, no debt, right? So that was cool. So NHSC, basically you have to commit, like once you've gotten an acceptance letter to PA school, you can apply for the scholarship and then they'll pay for your books, for your lodging, for your living expenses, for your tuition, everything. And what you have to do is you have to commit to working in an underserved population for like 2 years. If you're going to be a dentist or a doctor, then it's 4 years. So yeah, that's cool. Military, yeah, 100%. If you have an acceptance letter to PA school and you want to be in the military, yeah, go to a military recruiter. I would certainly recommend Navy, probably not Army, probably not Marines, maybe Air Force. But I would certainly recommend Navy because you're always in a coastal city. So you're going to be stationed like San Diego, Florida, Hawaii, Spain, France, Italy. Whereas if you're in the Air Force, you're going to be stationed in like Wyoming, Idaho, freaking Arizona, like middle of nowhere type places, Germany. So I think Navy is best. But anyway, yeah, same thing as the NHSC. They will pay for your PA school while you're in PA school. And then you basically have to be a commissioned officer for 4 years, 2 years, whatever it might be, to be a medical officer, basically. Which, not the worst job in the world, but they're going to work you pretty hard. I got into a program that's starting their first ever cohort in January. Is it a good idea to join? Oh, okay. So I'm going to say yes and no. Yes, because if it's the only program you got into, you may as well just do it. Just be prepared for chaos, like super chaos. New programs are always chaotic. They have a untested curriculum. They might have untested professors. They don't have mentorship because no one's gone through it. They haven't troubleshooted the curriculum because no one's done it yet. So just be ready for chaos. With that said, if you have another choice, like a program that's been well established, that's been around for 20 years, like Lemoyne College, I'd go there. But if it's the only one you've gotten into, just go for it, man. Just be ready for chaos. Be ready for that in any program, honestly. Like any program is going to have disorganized professors. They're going to have disorganized bits. People are, they're human. The professors are human. Things change. COVID happens. Things happen. But a new program with your first cohort, that's going to be the most chaotic. So if it's your only choice, go for it. Otherwise, I would recommend against. Okay, Abby said, I feel you. I'm interviewing for a January start program. I feel like I wouldn't be ready. What do you mean you wouldn't be ready? You're ready. By the way, thank you for everything. I appreciate the support, Christian. Yeah, I got you. Were those study tips helpful, Christian? I really hope they were. Abby said, seeing it's the first cohort, I feel like, okay. So they're just talking. That's cool. They're just talking in the comments. Established with a med vet school, blah, blah, blah. Thank you very much. PathA is my dream, and I'll look for the video. Yeah, if you can't find it, AJ, just direct message this account. I'm the one who usually checks it. Sometimes it's other people, but usually it's me. And I will link that video for you, okay? Because PathA, all these other mid-level careers like perfusionist, what else is there? Anesthesiology assistant. I really want people to know about all these to make a very informed choice because PA is not for everyone. Everybody's got something that they want to do, and sometimes it's not PA. Sometimes PathA works better. Sometimes anesthesiology, perfusion. These are all great careers, So I want to just assist you with any career that you want, not necessarily just PA. Just because I'm a PA doesn't mean it's the only career for you, right? So yeah, if you can't find that video, just message me through this app and I'll send you a link. I'm applying for a school, first cohort, but they have a med and nursing school that's very well known. That's good. Abby says that. Still, it's still a new program, so I'd still be a little concerned. But anyway. Is that it? No, there's way more comments. Here we go. How do you recommend handling an interview question that kind of stumps you on the spot? Great question. Who is this? Claire? Great question, Claire. Okay, so the mock interview I did like an hour ago that motivated me to do this live, she did a wonderful job with this. She did a phenomenal job. And what she did was she literally just leveled with the interviewer, which was me. She literally just leveled with me and she got stumped and I could see her freeze up. And then she was like, I'm sorry, I'm nervous and I lost my train of thought. Could you please repeat the question? What am I going to say? No? Like, of course I'm going to repeat the question. So she did a wonderful job with that because she was just honest. And she just said, I'm sorry, I got nervous and I lost track of my thoughts. Could you please repeat the question? That's fine. Or, well, you said that if the question stumps you. So if you know what the question is and you're still stumped, then you could just say, great question. I'm sorry. May I please have a few seconds to gather my thoughts? And then you have a few seconds just to think about it. Now, don't sit there for like 2 minutes while they're just looking at you. Like, that's a little too much. You should be able to come up with something. So yeah, just whatever comes to mind, an example, a reason why you want to be a PA, something specific about you, a situation that happened at work recently, anything. Like, you shouldn't be freezing up for that long if you've practiced, right? Let's see. Okay, Abby's just kind of helping the other person. What do you think is realistic time frame for interview prep? Okay, that's a really good question. So I don't think you have to go crazy. I don't think you have to prepare for like 12 hours. Like, I've heard that number sometimes. That's crazy. I think if you use my method, it should only take you about half an hour a night. I wouldn't do more than half an hour for like maybe 5 or 6 nights, maybe a week or so. If you do what I instructed, get those 6 basic questions answered very thoroughly, and then practice segueing from your standard questions to those, and you do the 4-step method on ethical and what's the other thing? On ethical and situational questions. If you do those 2 things, it shouldn't take you more than 30 minutes a night for like 5 or 6 nights. If your interview's tomorrow, I'd probably put in a good 2 hours with some breaks in there. If your interview's in like 3 days, I'd probably put in like an hour or 2 tonight, an hour or 2 tomorrow, and you should be okay. But it's preferable to do less but more times, right? Let's say you're like practicing hitting a tennis ball. If you practice for 30 minutes every day for the next week, you're going to do way better than practicing for 6 hours just today. It's just how it is. So that's a realistic time frame, I think, Abby. What makes me feel better? That makes me feel better. I was just told by someone that I need to prepare for 6 weeks. For what? 6 weeks? What are you going to prepare 6 weeks for? Like, okay, you're not taking a PhD dissertation in like freaking rocket science. Like, there's not that much to prepare for. You're talking about yourself. You should be an expert in yourself. I'm an expert in me, right? So you're talking about your application, which you painstakingly already made, so you should know it pretty well. And you're just practicing answering questions. Like I said, there's only 6 basic types of questions, so you really just kind of practice those. And then there's that 4-step method for answering scenario questions. That doesn't take that much practice, guys. 6 weeks is insane. 6 weeks is like taking the MCAT. Or, oh, that's like 3 months. 3 to 6 months. So yeah, that's crazy. I have 2 weeks, so I feel decent doing 2 to 3 questions a day and getting a story bank down. 2 to 3 questions a day is kind of low. Like, I want you to have legit practice for like, half an hour at a time. Half an hour is like 5 or 6 questions, right? Easily. You should be doing like 2 to 4 minutes per question for a solid, thorough response. So I don't think that's really enough. Now, if you want to supplement that, you could use like the, million mock interviews we post. Our YouTube channel, Personal Statement Pros, we actually have a mock interview playlist. So it's all the full-length mock interviews I posted on this channel, just all in one playlist. And a great thing you can do is really like go dress professional, get in front of your computer, pretend it's the real deal, and then sit down with one of those mock interviews and just pretend the question is yours and then answer it. And then see what the mock interviewee did and then go, fast forward to the feedback, right? That'll make it feel real. Plus you'll get to practice. Plus you'll get to hear some hear me tweaking their response. So that's a really good way to go. Practice with your friends. So yeah, I would say half an hour a day. What do you recommend doing for a writing portion? Okay, that's a great question. So the writing portion isn't really any different than the rest of the interview. The only difference is you're not speaking it, you're writing it. So I'm sure you guys who watch the channel enough can probably guess what I'm going to say. Practice. If you are sure that there is a writing portion of your interview, then that practice, those half-hour sessions, I would make one of those a writing session, right? Practice just getting, your list of PA school interview questions and just practice responding in written form instead of oral form. And it's the same thing. I just watched every interview on the playlist. That's exactly what I did. I paused and answered. Abby, you're the bomb. Okay, Abby, you're like over-prepared. You're like so well-prepared. Like, I'm glad that you're like doing all this, but if you watch every single interview, that's like hours of interviews, I think you're pretty prepared. I do a lot of passive prep, listening to all those, and then answering while I drive. Good. Be careful driving. Don't crash. I feel bad. How would you answer why? Okay. How would you answer why our program if there isn't really much on their website? That's honestly kind of tough. We did that last time. Like we looked up Pittsburgh and their website is pretty dry. So I would stalk their Instagram. I would maybe cold message some of their students. I would look up the area, whatever hospitals are nearby. See like if that's somewhere they get rotations. Maybe look up something about the hospital. Like, oh, I'm really interested in this program because maybe I would get a rotation at this hospital and I see that they X, Y, and Z and I think it's cool. They have a PA-led neurosurgery team, whatever it may be, right? So that would be a good one. The area is definitely a good thing to bring up. Maybe look up the professors, maybe look up their resumes, look them up on LinkedIn, see what specialty they have, see where they've worked. Maybe, oh, I heard you guys have a professor that did a lot of wound care. Or I saw a professor who teaches as an adjunct, does a lot of, I don't know, they worked in robotic, Roux-en-Y, gastric sleeve, whatever, weight loss surgeries, which I'm really interested in doing. Like, I'd love to learn from them. I don't know, something like that. Like, just anything specific. Cold message old students. I had one agree to FaceTime me and tell me about their experience. Yeah, that's a great idea. Now, that's something that's not going to be, like, immediate. Like, if your interview is tomorrow, you're not going to form that relationship that quick. But if you're interested in a particular program, even before you interview, it would be great to start cold messaging some of their students. Like, look them up on Instagram. Every PA program has a current student's Instagram. So you could just cold message a bunch of them and then just ask them how the program is. And some of them are going to ghost you. Some of them, especially if they have a bunch of followers, like it's going to be in their like requests or whatever, which they don't check more than every 2 months. So they may not see you, and that's fine. But some of them don't have a lot of followers, don't have a lot of friends, and they are going to see your message and they're going to be like over the moon that someone's giving them attention. And or they might be frustrated and they want to complain about the program. Be their listening ear, listen to them, and then maybe they'll give you some insight about the interview, about the program, about like how things are run, some good questions to ask. Who knows? Make friends, I have an interview next week. I've been practicing with your videos. Good. Who is that, Imani? If you've been practicing with our videos, hit the like button, please. Okay, so let's just recap the really important stuff then. All right, let's just recap the important stuff. And like I said, I'm going to work on this resource. I'm going to make this like a downloadable thing for you guys. I just have not had time. But here we go. Okay, let me flip my camera one more time unless there's more questions. No more questions? Okay, cool. So let's flip my camera one more time just so you guys have this resource one more time, and then I'm probably going to get off of here. So this is is this highlighting making it hard to see? I think this orange is making it hard to see. Give me like 1 second. Let me make this not orange. There we go. Okay, so 4 scenario questions. The 4-step method is, just focus real quick. Okay, 4 scenario questions. So this is like, an ethical question. This happens. What would you do? Or, you are a PA working in emergency medicine. This happens. What would you do? Scenario questions. First things first, demonstrate understanding. Don't immediately start answering it and be like, oh, I would do this. That's wrong. That's step 3. Step 1 is to communicate understanding of the problem. So repeat it, restate it in your own words, something quick. Just demonstrate that you know what you're being asked. 2, get more information. 2 is the most commonly skipped part, and 2 is the most important part. Because the way I really teach this is, imagine you go to your doctor, your PA, your nurse practitioner, you say you have a headache, and they just say, you have a migraine, go away, and they just leave the room. You'd be pretty pissed. Now imagine they sit down with you, they ask, do you have a history of migraines? Did you hit your head? Are you on blood thinners? Are you on any new medications? Have you taken Tylenol? Are you having blurry vision? Are you dizzy? You'd actually feel like that provider cares because they're doing step 2. They're getting more information. They're asking questions. Now, this is hard to do when it's just you talking and if you can't really ask them questions. So you can make assumptions. Let's say they say that you are a physician assistant working at the ER. A patient comes in and, they are concerned that they might be positive for HIV. What do you do? Well, instead of saying, well, what I would do is definitely get some PPE to make sure I don't touch their blood, and then I would leave the room. Like, okay, first off, don't do that. Second, that's skipping to step 3. I want you to skip to step 2, right? Well, actually start with step 1. Okay, so I'm a PA working at the emergency room. I was just, assigned a patient who is concerned they might be HIV positive. So, okay, cool, that's step 1. Step 2, I would ask, so Why are they concerned they might have it? Did they just have a sexual encounter? Who was positive? Are they having symptoms? Did they test positive somewhere else? Why do they think they might have HIV? I would also ask, are they sexually active? Have they had any high-risk sexual activity, such as with prostitutes, overseas, homosexual activity? Are they using protection? Any high-risk activities for HIV? So all of those kinds of things. I'm also surprised TikTok hasn't flagged this for mentioning this part, but anyway. Okay, so I would get more questions, make assumptions, just ask about things I'd want to know. Just show that I'm inquisitive. Then 3, come up with some different solutions. So firstly, I would see if they know for sure they're positive or if they need testing, if they definitely contracted it. We would definitely put on some PPE. We'd make sure that we use precautions. We would test them. We would get them connected to infectious disease and treat them. I would also sit down with the patient, be very empathetic, let them know that there are treatments. It's not the end of the world. They can still have a normal life and normal relationships. They would just need treatment. So I would do all those things. And then 4 is basically like what you would do. So that's it. So do you guys see how this 4-step method, if you just practice it, it's literally just going through the motions. No matter how complicated the scenario is, it doesn't matter. All you have to do is just go through the motions and you have a very solid, very, very impressive response. If you just clarify the problem or identify the problem, repeat the problem, whatever it may be, ask questions, any questions that come to mind whatsoever, and then come up with some different solutions based on those questions. And if you're asked to pick one, then you pick one and you talk about why. That's literally it. That's all you have to do. Amber Lynn says, this is great. This eases my anxiety about these types of questions. Good. That's what it's supposed to do. Like literally all my methods, everything I teach is to make you guys less anxious and more confident because you've been there before. Okay? So literally with anything you do, whether it's interviewing, whether it's treating patients, whether it's playing tennis, whether it's speaking publicly, whether it's speaking on TikTok live, right? The more you do it, the more confident you appear. Like, I don't know. I like to think that I probably appear confident right now. I like to think that you understand what the words coming out of my mouth. I'm not speaking too fast unless I am, which I do a lot. I hope you guys think that I'm comfortable here. I feel confident. And if I was your provider, you would feel confident in my decisions because I've obviously been here before. So if you are reading questions, if you are watching videos, but you're not actually doing it, you're not actually practicing interviewing, you're never going to get confident. And you're going to get there and you're going to have so many things to say and you're either going to blank or you're just not going to know what to say. And you're going to be nervous and stammering and I don't want that for you. What I want for you is for you to just be flowing and confident and happy and knowing I've been here. This is just another walk in the park. I've already done this. That's how you appear confident in your interview. And of course, the content matters too. What you say matters. But, we talked about that before. So anyway, so that 4-step method is how I advise doing ethical and scenario type questions. And just one more thing about that before I end this live is the coolest thing about this is it works in groups too. It's not just individual. So if you have those 4 steps memorized, it's not just individual interviews. It's groups too. So a lot of times for group interviews, what they will do is they will have a scenario or an ethical question or some activity involving a hypothetical scenario. So you're not going to get to mention all 4 steps. What you're going to do is figure out which of the steps has not been covered already and just add that. And that's your contribution. You don't have to wonder. You don't have to wonder what do I say? What do I do? You just add one of those 4 steps. That's it, right? So let's say you're the first to speak, restate the question. And then maybe ask some questions, some things that you want to do, steps 1 and 2. Let's say, a lot of people have already spoken. You're kind of in the middle. I would probably go with step 2 and 3. So you probably ask some more questions if you have any. And then you start thinking about okay, this was asked. We know this. So now we could possibly do this, or we could do this, or we could do that. You could do that. If you're one of the last people to speak, step 3 or 4. Here's another scenario. Here's another option we could do. I personally think based on everything we've learned, we should do this. Here's the reason. What do you guys think? Step 4. That's it. So literally those 4 steps, you always have something to say in a group or individually. Okay? All right. Guys, if this was helpful, if this 4-step method is helpful, if the 6 basic questions are helpful, if me systematizing this stuff based on 5 years of experience interviewing people helps you, please hit the like button. Let's get to 1,000 before I end it. I know there's not that many people left, but if this is helpful, help me out, help the channel grow. Nora, thank you for the follow. You are awesome. Who was that? Is that a swan? Anyway, someone just followed us. Thank you. Amber Lynn, thank you. Thank you guys for hitting the like button. Any other like last minute questions, post them in here real quick, but I think I'm probably gonna be done for the night. And we'll try to post more lives. Also, Elijah finally is gonna he's gonna resurface from his PA school training. He is going to do a live, I wanna say Thursday or Friday of next week. He's going to be actually live editing a PA school personal statement that somebody sent us. Get better soon. Thank you. Wait, how'd you know I was sick? Anyway, yeah, so somebody actually sent us an essay that they're going to allow us to edit live on TikTok Live. So Elijah, one of my other coaches, the one after me, who's been doing this the longest after me, he's going to edit the essay live on TikTok. I want to say Thursday or Friday. So be on the lookout for that. And then I think I'm probably going to edit the same essay, maybe some night this week or maybe the following week, just so you kind of get both perspectives, how he would edit it, how I would edit it, that kind of thing. So we're still doing essays, not just interviews. So anyway, if you guys want our help, personalstatementpros.com. You can book a session with myself, with Elijah, James, Jasenia. Juliana's our pre-med coach. She's phenomenal. She's like too shy to come on TikTok, but she's phenomenal. She knows everything about med school. Do you have anything similar method for supplemental essays? What do you mean? Like we grade supplemental essays, if that's what you mean. Well, we don't grade them, like we edit them, right? So yeah, we handle supplemental essays, personal statements, interviews, application strategies, so personalstatementpros.com. That's where you go. And then we have free resources, we have services, pre-med and pre-PA, and then you can just book whatever is better for you. So that's me after I graduated PA school. But yeah, there's my book. There's all the different services, personal statement, emergency personal statement. Crap, I just remembered I have one of those due tonight, so I'm going to be doing this all night. What else is there? Supplemental essay editing, mock interview, obviously. Just a Zoom call if you just have questions, general questions. You want to go over your application. You want to just practice a few things, but not a whole mock interview. You want to strategize. This is a little cheaper than a mock interview. Email coaching if you just have some more complex questions, but you don't want to do a meeting, that's cheaper. International, if anybody is from India, I know India doesn't have TikTok, but a lot of people from India are trying to apply to PA programs, different countries. We actually have an expert for that. And yeah, that's about it for our services. So yeah, personalstatementpros.com, services to get our help personally. So yeah, thank you guys for the 1,000 likes. Thank you guys for tuning in. Stay tuned for the next live and let us know if you have questions. We will see you next time.